So, welcome to the show, Larry. So glad to have you.
Well, it's good to be here.
Thank you. So,
Thanks,
this
thanks
is,
for inviting me. It's exciting.
I know and we're really going to just jump right into the top 5 hottest aesthetic technologies that everyone needs to know about. So, you're always on the cutting edge of everything. And, anytime something comes out, you're the one I turn to. And I want you to share what you consider to be the top 5 current hottest technologies in aesthetic medicine.
All right, I'm happy to do it. I think part of what makes technology great is if it works well with others. It plays well with other toys, in the sandbox or whatever. And so we look at technology that can stand on its own, but we also look at technology that will work well in doing more things with other technology. So, when I walk around our office, we do have a lot of technology, and I was thinking, okay, well, what do we have that's going to make a difference? What's a game changer that we can talk about, and that we truly love, our patients love, and it has made a big difference. One thing I would say about technology is that over the last 5 years, it seems like everything has gotten more expensive, but it's gotten better.
Okay.
It's consistency. You spend a lot of money. I mean, and doing this for 25 years, we used to spend a lot of money, and 1 in 5 would actually see something. And so it's all about consistency now, and I think that's made a big difference. The other thing that I think people need to think about is you do need technology. You need more than one thing. The saying that if all you have is a hammer, everything looks like a nail. Well, that's true with this as well. So whatever you can do to get the top of the line technology and build it, have a little plan, start and build it.
Yeah, and that's
Um,
what I often tell patients who are looking for a procedure. I said, you want to go to someone who has a whole array of different devices, because if a practice or a physician has only one device, they're going to try to make that device work for all of your conditions. Whereas, if you're dealing with a brown spot or a red spot, they're
exactly.
not all created equally. So that's why I like at Clear Skin Institute, you have the whole array. So you may pull out one laser for one red spot, and then you could need to go to another one to help with the pigmentation. You're not trying to make one thing work for everything. So like for potential patients or clients, like that's pretty much our audience. So letting them know what to look for is really important, because it's so overwhelming out there with all of the options nowadays.
There are a million options. And again, most of the new technology makes a difference. And so when I was looking around, I thought, okay, I'm going to start with a device from BTL. BTL is a company out of Prague, Czech Republic, and they've been in business for 25 years, and they manufacture, design, engineer, and sell all their own products. And we have 6 of their devices. The one I want to talk about is one called Neo. And I want to talk about it because it is unique. So, again, having something in the industry that not everyone has really, I think, makes a difference and changes things for a lot of people. So, if you have a technology where you say to a patient, look, here's the thing, we can do a treatment on your abdomen, and let's say we do four treatments. On average, you would lose 30% of your abdominal fat and gain 25% of your muscle strength and mass. And all you do is lay there. We're
So
not
let's just
involved in
clarify. Let's clarify. So the BTL, the Neo, is for abdominal
It's actually,
tightening.
yeah, abdominal is one area, but you can
Okay.
do the glutes, you can do thighs, you can do bicep, tricep, you can do calves. So it is a full body device. And it uses what they call high fem technology, which is, again, unique in the industry. It's high intensity focused electromagnetic. So it's like a giant MRI, but focused. And so that technology, when you're looking for a consistency and you're saying, wow, I need to be able to make a difference in this patient. Well, if that patient lays there and does 20,000 contractions in a half hour, I don't know how you don't make a difference.
Hmm.
That's a big deal. When was the last time you had a patient do 20,000 sit-ups or crunches? It doesn't happen. And so you can actually talk to the patient about that. If that's something you would routinely do, no one does. The machine will do it for you while you lay there and breathe. So I think that's important. And you can do the glutes, which is, beautiful to be able to lift. Um, and to have people be able to make those kind of changes in a relatively short period of time. So we usually have people come in once a week, do the treatment, and a lot of times they'll do two areas, at each session when they come in. It's very easy for them to do, and it works. So it causes supra maximal contractions. And I think that's the difference. Muhammad Ali was asked, "How many sit ups do you do?" And he said, "I don't start counting until I can't do anymore." And so I think that's a big deal. It's like this is going beyond what you can voluntarily do yourself. And that's huge.
So you think it separates this device from other devices because it not only reduces the amount of fat, but it also helps to build the muscle? Is that why you think this is such a hero device?
It does do that. And when you're using the Neo, it's actually heating up the abdomen at the same time, because the advantage, the predecessor to Neo was the M Sculpt. And we had that for, I don't know, about 3 years.
Hmm.
And the M Sculpt was beautiful. It did all of that we just talked about, but Neo has added radio frequency to it. And so here's a company that's firing radio frequency through an electromagnetic field. I mean, it's kind of impressive when you think about it. And it automatically controls the temperature on the abdomen. So, it maintains it between 41 and 43 degrees Celsius. So, you're heating up the abdomen, you're heating up the muscle, you're heating up the fat. And of course, you're heating up the tissue, the epidermal tissue as well. And so good things seem to happen. So it's a really nice technology where you're not having to literally stand there or physically do anything. So a technician can hook a patient up and get the treatment started and take it up over time and increase the intensity. And people love it.
Yeah, I mean, what I've noticed, because I've done it in your office, full disclosure, and I can't get to 100% because I find it to be a little bit intense, but I still see results. I've noticed that I have diastasis, which is like separation of the muscles after having
Yep.
children, and it's helped quite remarkably with that. In addition to tightening up that loose skin after you have children, are you observing? Are you making those observations as well?
Yeah, it's dramatic. It seems like when you use one applicator over the center of the abdomen, it's pulling everything in
Like a
and bringing it
corset.
together. Exactly. So you're getting a really nice response with that. And I don't remember the exact percentage off the top of my head, but I think it's like 12 or 13% improvement. So it's pretty significant.
Yeah, I mean, that's pretty impressive, especially with the fact that you're not undergoing any surgery. You're in and out. Nobody knows what you did. You can go in for, during a lunch break. It takes what, 25, 30 minutes, and then you leave, and it's sort of like a mini gym workout. So do
Yeah.
you find that there's certain patients or there's certain people that do better with these type of with the neo procedure than others? Like, are there the people that work out at the gym regularly and it works as a bonus? Or do you find that just anyone can do it, even sedentary people that want some sort of a lift? I mean, what's the ideal kind of patient for this?
I don't know if there is an ideal. I think people that get the best bodies are those that are somewhat defined to begin with.
Hmm.
So if you already have some definition, this will give you unbelievable definition. It's huge for that. But for the more sedentary, but need strength, they really want to improve their overall and maybe get rid of some fat and just get stronger in the core. Fantastic for that. And we actually our patient base is probably an average of 40 to 70, 75. And we find that a lot of our older patients really get a tremendous benefit from this. And I think the company tends to market it with photos and what have you of the more sculpted, bodies, hot bodies out there. Um, we have those, but nobody has hundreds of those uh, just available. But what we do have is a very large population of people that are a little bit older and need some tightening and need to firm up. And it does work on anyone. I think BMI up to something like 35. So I mean, even very, very large can make a difference. And but I do think it helps rebuild that muscle, gives you your core back, increases your balance, so you're less likely to fall as we get older, and just maintain your independence. And that's true too with your arms. I mean, if you get stronger in your arms, if you do your quads, get stronger there, it helps you as you are older, and you tend to have less and less muscle or strength in those areas.
Yeah, I
So
think
it's
that's a
all
great
good.
point. Yeah, I
Yeah.
love that point. I feel like the initial technology on body sculpting devices was more about removing fat, and now we've gotten wiser, and and the Neo really delivers in that it builds muscle, which
Yeah.
is so essential to have muscle centric metabolism because we need the muscle. Sarcopenia happens as we get older, and the more muscle we have, the longer our lifespan is going to be, and the better our lives are going to be. So I love that this device builds muscle and also reduces fat. So I'm glad you mentioned the Neo because it's definitely one of my top favorites. Okay, so what's your next top one?
Well, it's since I'm on the topic of high fem technology, I had to go to EMSLA. I think EMSLA was actually produced before EmSculpt was, maybe 3 or 4 years ago. And EMSLA uses the same high fem technology for incontinence. And most aesthetic facilities that do what we do, you're not sitting around thinking about incontinence all day. You're thinking about fixing, hoping someone's face or body or something like that. Um, but we did a lot of fem treatments and uh, for vaginal and labial treatments and things like that. But frequently, what was being discussed was incontinence, and so that was such a common situation. And it happened. It happened all the time. And so for us, adding the chair in which a person can come in, sit down, assume the position, so to speak, and do a 28-minute treatment with 11,000 kegels. And so what you're doing is you're rebuilding the entire pelvic floor without doing anything. You're watching television, or you're reading a magazine, or you're on your phone or iPad. It is that easy. We do it 6 times. It's very cost effective treatment. You're not doing surgery. And I remember flying to the East Coast, and at a at some location I was at, a lady sitting next to me, her purse fell open and all these pads fell out.
Oh,
And I thought, it's like women are having to carry all these pads around, and they've got extra underwear, or they've got a pair of black jeans in their car, and all these kinds of things for incontinence. And this isn't 100% on everyone, but almost everyone we've treated, which is now in the hundreds, have gotten better. They've had quite a bit of relief. Many of them 100%, and just sitting on the chair. And if you ask a patient, when was the last time you did 11,000 kegels? It's like,
never.
when was the last time you did 20,000 sit-ups? It's the same kind of question. Nobody does it.
Yeah,
And if they can just sit there and do it and improve their life, why not?
right. Exactly.
So
Yeah. I
it's
think
been an
that's,
exciting, yeah.
yeah. So
Yeah.
that's the EMSELA. It's EMSELLA.
Yes.
And what's the protocol? Can you review the protocol for
Well,
everyone?
what we do is 6 treatments. You can do 2 a week for 3 weeks. If that doesn't work, come in once a week, for 6 weeks. Easy. You come in over lunch, you sit down, you do the chair. And we incorporate the chair with a lot of other things we do, that where we're doing a treatment that we're putting numbing on the face. And while you're numbing, you can sit on the chair. So there's just benefit all the way around for patients. And even though this isn't, again, what we would call an aesthetic treatment. It is so beneficial in so many ways to your patients. And I remember an OBGYN telling me, he said the easiest way to remember it is if you're in your 30s, 30% have incontinence, 40s, 40%, 50s, 50%. And it won't be statistically exact, but something like that is correct. And we know by looking at all the companies that are advertising pads, different disposables, and things like that, the growth of the industry is so much. It is a much, much larger industry selling diapers to adults than to babies. And, you buy a baby diaper at Walmart, dirt cheap. The same adult diaper is 10 times more. So it's just, it's a big business for these companies, and that market seems to be growing substantially every year. And so this is a nice option for people.
Yeah, I think you bring up quite a few good points. I mean, it's very under discussed.
Yes.
Even women talking to women, we don't really discuss that. And it's not even something most doctors even ask patients until it's gotten really, really bad. So, but I think if you ask most women, they limit the activities that they do. They may not run anymore or jump on a trampoline, or, when they laugh too hard, there's some urinary incontinence. So it has little ways of presenting itself. And then slowly after time, like you might limit the activities you do, and then you're not running and hiking, or you're not doing things for such a long period of time because you're worried about the incontinence. And sometimes the price points of some of these procedures can be overwhelming for people. But if you think about, the cost of pads or diapers and what that accumulates to over time, they're well worth it
Yes.
because it gives you so much more freedom in your life. And those numbers are actually very similar to what we see with erectile dysfunction in men,
Mhm.
and in the 40s, 40% of men are having issues. So what can the EMSILA device do for men with the pelvic floor? Because we know the pelvic floor, I mean, with childbirth, it tends to get weaker, but also gravity over time in our posture and sitting all day, like the pelvic floor gets weaker. So the EMSILA basically is helping to tighten your own pelvic floor naturally without surgery, without any pain or procedures. It's just basically doing the Kegels we're supposed to do all the time, which we don't always do properly. And it's hitting the right spot with the intensity that we can't really do. But talking about the EMSILA with men, like how does that work?
It's interesting because we've had two urologists come in, male urologists, sit on the chair, and they were much more interested in their male population than female.
Yeah.
And I found that interesting. But for me personally, I used to get up and go to the bathroom 4 times a night. And I'm old as dirt, so that just happens. And so you start thinking, well, this isn't much fun. You wake up 4 times and you got to go back to sleep, and you end up losing sleep and things like that. And so by sitting on the chair, I get up once a night. So that's a big difference. And basically, it was explained by one of the urologists that you're really treating the sphincter on the male, and it's
Hmm.
just a small muscle that wears out over time. And by literally treating that, because you're not really treating the prostate, it all by itself makes a big difference. And so, yes, men can benefit, women can benefit, and the other little side benefits, they have two protocols. A second protocol that they have added and included on the device um, seems to enhance blood flow. So when you're sitting on this, you just think you have a magnet. And you're sending the energy up between the rectum and the vagina, so that entire area is getting treated. And of course, if the vagina is getting treated, or if the penis is getting treated, anything's getting treated, and this thing is causing 11,000 contractions over that period of time, there's going to be increased blood flow. Increased blood flow does good things to everything on the body. So we like it for that as well.
Okay, that's great. That's really great because I know people reach for nitric oxide boosters and,
Yep.
obviously a lot of other things to increase blood flow. So there's quite a few benefits from the MSLA. I love that. Okay, what about your third hot aesthetic technology?
Well, this is a device that we bought 3 years ago, and we didn't want to buy it. You get in this mode where you've got so much stuff, and you think, the last thing I want to do is spend any more money. And before we were done, we ended up buying three devices, and we've used them all. But this device is called the Agnes. And Agnes was developed by a dermatologist in South Korea, Dr. On. And I think he's brilliant. I talked to him. He was actually at our clinic. And it's my understanding he has 18 clinics in South Korea, all using the device. And it's a radio frequency device that changes volume, so in other words, it kills fat in small areas. You wouldn't do an entire abdomen, but you do small areas, but can also tighten skin. And, in South Korea, they have like 100 needles. Here in the US, I think we have 9 or 10 needles that are FDA approved for different things. And it's really precision RF that allows you to go in and treat face, every different areas on the face and neck. So if you're looking at a face and you're going from the top down, upper eyelids. So you can go in and treat upper eyelids and contract that tissue. And the
Wow. Okay.
contraction is really quite good. It's very good. And you can go below the eye and treat the fat pad. So you have herniated fat pad, and you can treat that by pulling down on the orbital ligament, and then putting a little pressure on the globe of the eye. The fat pad just comes out to you, and you're able to just go in with a needle, and you literally hear the fat sizzle as you fry it. So you
Hmm.
are killing the fat in the area. And so the eyes are a very important part. And I got convinced because I watched the procedure being done, and I thought, okay, we don't do that. We can't do that. We should be able to do that, refer all that out. Why are we referring it out when it's that easy? So I think that's it. You have to look at technology and what it's going to do for your practice. And if you have a little bit of a game plan and you shoot for it, it makes a difference. But we do a lot of eyes. As you go down the face, the buccal area is really, we have a visia, and for those of you out there who have a visia, and if you take someone's photos and you go to the simulation that shows what you look like 10 years from now, and then 20 years, and then 30 years, what you see is the face drop.
It's
And
horrifying.
it's
You've done it to me. It's horrifying.
so freaky. It's like, wow. So right now, 5 years ago, I didn't have this. It's now driving me out of my mind. So I got little buccal areas right here that we're going to go in and kill that fat. But what happens is if you don't have a way to do that, people are asking you to tighten the skin, and you're trying to pull this back against fat, against an obstruction that's not supposed to be there in the first place. And so I think by taking and having a tool that allows you to go in and sculpt that and get rid of that and really shape it with beautiful precision. So it's like surgery. Uh, and yet it's a non-surgical treatment. And once you do that, then you take a look at submental, and you can look at jawline, both above the mandible and below the mandible, going all the way.
Submental means like under the chin for those of you who are wondering. So submental is sort of like that little double chin that some of us get.
And so, again, what a great treatment for doing that. So, what it's allowing you to do is change the shape, the architecture of the face, resculpt the face without being a surgeon. And you can do that with a tool. And the tool is really designed to do it and do it well. And so, you might get rid of that and then change needles and do a tightening procedure here. And then you can even add another technology that also tightens after that. And that's what we do. And so we just try to build where we stack some technologies with the idea. Um, it's modification of different zones, So how do you redensify the dermis? And you can be in different layers, and you're trying to contract the tissue and pull that in, and so what we try to do is use two or three different technologies to give us the biggest outcome by doing all these different zones of modification. And so Agnes is beautiful because, again, it's putting like a surgical tool in your hand. It is so precise. It is easy to do, and you'd be shocked. You end up doing it every day. You're doing
Yeah.
this.
That's
We're,
great. I
we're
mean,
not high volume. We're much more fewer people, more treatments.
mhm. Yeah,
And
because it's a comprehensive approach. So it's not like there's just one thing that's going to work for everyone. And I think that's an important point that you make because, while somebody might be focused on the fat pads under the eye, because as we get older, what happens is our face turns into like from a heart shaped face to like a trapezoid face. So we lose a lot of volume from above and it kind of sags below. And the fat in the face just it goes south basically on the body and on the jawline and stuff. So what Larry's saying is like these sort of approaches using the Agnes, like the woman's name Agnes, is it helps with those little fat pads that are pooching out under the eyes are really nice, but at the same time it's tightening as well. Yet that's not the only issue that people usually have. You might be focused when you look at yourself in the mirror on the fat pads, but you want someone who has an aesthetic eye, who has a whole comprehensive plan for you so that they're like, okay, we'll address that, but we also want to tighten and we want to build collagen and we want to help with texture and tone and do all of these other things. That's why it's just vital to realize there's not one thing that's going to fix it for everyone. It's a really personalized plan.
that's correct. And what we do is what we call a non-surgical facelift. And it might involve three, four, or five different technologies, and it's not all one time. It might be over 6 months, 8 months, 12 months to get everything in that we want to do. And we'll involve filler in it. We might involve thread lifts in it. We might involve, photofacial and other things. So you look at what you do a really good assessment and you determine exactly what's going to make the difference for that patient. And, you just have to explain to a 65-year-old, it took 65 years to get to this point. Why don't we give you a really nice, healthy, natural look over time? So
Yeah.
it's not anything real crazy at one time. And we do really crazy resurfacing here. We do all of that type of stuff, but it's like, where does it fit on that face so that when they are done, it's amazing? And if
Right.
you treat for amazing, I think people will be very happy.
Yeah, I think that's also a great point about it being a stepwise approach. Like you don't want everyone saying, "What did you have done?" You just slowly want to look a little bit better every month, every, 3 months by doing these incremental procedures to kind of reverse age. Now going back to the Agnes though, what's the downtime? Like what kind of post procedure what can people expect? Is there a lot of swelling? Is there a lot of pain? Do they have to avoid social activities? Like when are the best results achieved if somebody was going to schedule with you and then have a wedding? Like what's the timeline for something like that?
Well, it depends. Like we do a nose lift,
Hmm.
and the entire procedure takes about 7 minutes, and
With
it
the
is
with the Agnes?
Vegas. Yeah. And so you can just tighten this up and lift the nose, and it is just right in front of your eyes.
Wow.
It is so cool. And it doesn't take much time at all. And downtime, all of that, zero. I mean, it's nothing. Now, if we're doing, a big double chin, well, we're killing fat. And so it's not going to be a lot different than Kybella. You're going to have swelling. And how much swelling and all that varies a little bit from patient to patient and how aggressive the treatment is. And sometimes you have to do the treatment more than once, just like Kybella.
Yeah.
Um, so I would say that most people would have swelling in a bigger area like that for up to 2 weeks, most of it in the first week. And then things calm down. If you can sleep somewhat upright, like in a recliner or something like that, you'll have much less swelling. If you lay flat, you're going to have more swelling. Can you do steroids like prednisone and things like that to decrease the swelling? Yes, of course you can. We prefer not to, but that's if you need to, yes, you can. Uh, Eye bags might be 1 to 2 weeks also, sometimes less. I mean, on some people, it's like,
Yeah.
wow, that took no time.
It's so
But
much quicker than surgery.
yes, it's really easy. These are easy procedures for the patient to go through. But we do tell them that their final outcome is 4 months after the last treatment, whatever it is. And the reason is we're assuming that if the patient is 50, 60, 70 years old, we're dealing with the dermis and the skin and everything that is 50, 60, 70 years old. It hasn't had other treatments. So we're not dealing with someone that's, 25, 30. It is going to take longer for all of it to heal and for you to get your final look. And so if we do, like today, I've seen 3 patients today that all had Agnes, and it's 6 weeks out, and they look so much better already, but it's not done. So, at 3 months, they're going to look better, but even at 4 months, they look better than at 3 months. And so we usually
Nice.
tell people we'd like your final photos at 4 months.
Perfect. Now, how
Yeah.
does you mentioned Kybella for, the double chin
Mhm.
versus the Agnes. How does the Agnes compare to the Cool Sculpt in your experience?
Well, we don't have the cool sculpt. I'll be honest, we don't have any technology from publicly traded companies.
Yeah.
And that's just us. It's philosophy we have. Does Cool Sculpt work? Absolutely. But what we believe is that if we're killing some fat, we need to be tightening.
Yeah. Yeah, that's where I was going with that.
Yeah, you've got to tighten. I mean, you're going to kill a bunch of fat, no matter where it is on your body. If tightening isn't part of your procedure and the protocol, and maybe even some follow up tightening, you're not going to be happy. And
Especially as we get older, like the skin just doesn't bounce back as quickly. So if you remove the fat, now you have extra skin and that's not as satisfying.
exactly,
Yeah.
exactly. So I think, having the fact that the Agnes has skin tightening as part of it, and that we do, in addition to that, another device with skin tightening following Agnes, so that you're actually getting 2 treatments of skin tightening following whatever, treatment we did to kill fat.
Awesome.
Yeah,
Okay.
it comes out good. Really, this is very exciting. The other thing is we're treating people who've had fat injected into the face. And sometimes it's asymmetrical, or one side has a little too much and it doesn't look right. We can go in and do that. Liposuction, where you have just this little pooch or little bulge someplace, rather than trying to, bring out all the technology to do a little area like that. We can do it with Agnes, and it's really quick and easy. And, so yeah.
That's a great point. Yeah, because I know when they do, fat transfer, basically, a lot of times when people are undergoing a plastic surgery procedure, they'll harvest some fat and then inject it in the face. And around 30% of the time it takes, but sometimes it'll take more in one area and not so much in another. So that's nice to have that option as a treatment for that asymmetry where the patients don't have to go under anesthesia again also. Okay,
Yeah.
so what's your fourth hottest technology?
Well, I'm going to stay in that same field,
Sure.
with, micro needling RF, which is just hugely popular.
Mhm.
So both of these devices are sold in the United States by aesthetic management partners. And this one's called Scarlet. And it's also designed and manufactured in South Korea, uh, by Dr. Na. And he created something called the Na effect. And it is actually how the device delivers energy to tissue. And so what we're trying to do is when we're creating wound geometry, so to speak, on tissue, we want to change the architecture of that tissue. We want to change and re-densify the dermis. You want to have your energy in the right location, the right places, not sitting all up on the epidermis. And so a lot of microneedling RF devices will have insulated and non-insulated needles and all that. This one doesn't. It only has non-insulated needles, but the needles are designed in a specific way that the energy comes out like a teardrop, where the bulk of the energy is deep in the dermis, and then it gradually funnels up to the epidermis. And it's fast, it's smooth, it's safe. And I mean, literally, you can probably treat the entire body with it. And we use it everywhere. But it's a nice, simple system that we combine with other things. Like when we're doing photofacial, we may combine it with that. We may do it as a standalone. We always combine it with Agnes. And so we can set the depth to what we want. We can set the speed to what we want, what our energy level is. And again, we can go all the way up into the hairline to do the scalp. We can do forehead. We do eyelids.
Let's talk about what the indications are for the microneedling RF. So, like, who's a good candidate? What kind of person should seek out that treatment?
I would say anyone that is seeing skin laxity. So if you're starting to see loose skin, or if you've been seeing it for a while, I mean, this is a device that will tighten skin pretty substantially.
So, stimulates
And
collagen, heats up the collagen. The teardrop microneedling is going to just stimulate collagen. Like 3 to 6 months, you're going to look even better.
that's right.
Okay.
We
What
do
about
want,
acne scarring?
yes, yes, you can do acne scarring with it. Um, Scars of any kind, stretch marks. We do that. We do breast, not an entire breast lift, but the nipple and
Oh,
areola
that's interesting.
lift. Um, and I mean, you might actually lift a small breast, but for the average breast or whatever, it's, they may have implants or they may have whatever, and the breast itself is fine. But over time, the nipple and areola head south. And so you just, do treatments to elevate that and bring it up so it's more perky. So
Just
again,
like
you
right above the nipple, you work so that it tightens there and the nipples come up.
at the area of the areola, and we just
Hmm.
go up from there, and pretty much a little medial and right over the front. Um, yeah, it's
It's
very,
clever.
very easy to do. And I think it makes a big difference for a lot of people. And you can do the glutes. There isn't any area you can't do with it really. It is pretty fast. It's pretty easy to do. And you just, your depth. The big thing is how you do it. It's never so much what you do as it is many times how it's done, what's your technique. And we do a lot of vectors with tacking. So it's the technique is really the curl, the tacking, so that you're constricting, you're actually contracting the collagen and all the stuff in the dermis. You're contracting that to the point that you're going. So you're always bringing it up, you're lifting it, you're curling it back, or you're going up with it. And whether you're doing a stomach or you're doing breasts or you're doing the mid-low face or neck, it's beautiful for that.
Yeah,
And
that's a
so
great point because I mean, we talk about all these technologies, we talk about fillers, we talk about Botox or neuromodulators, and it's not the product or the devices themselves that are always the best. It's really in the hands of somebody who's doing it, who knows what they're doing. It's in the technique.
it is
And yeah,
technique.
because if you pull the skin down, you're going to have that kind of momentum in the treatment, right? So the tacking is huge with this device. Okay.
Yeah. So, and again, pretty much anywhere. And you can feel free to use it all by itself and just do a series of them. But I'll just say in general, technology is good enough to get your consistency. I think where we fail is that people undersell. And if you undersell, you underachieve. And so, people that should be told it's 6 treatments are being told it's 4.
Yeah.
We can help you in 4, or we can help you in 2, when really it should be 4.
Or 2
So
weeks when it's really 4 months to see the results.
exactly. So I think the big thing is I travel all over the country and I'm in different offices or whatever. For some reason, people are scared to, really say what needs to be done, or they're very conservative about that, and they won't talk about, the cost and what have you. And the technologies nowadays are expensive. The treatments are expensive, but they work. But you can't take, really loose skin and completely modify it and change everything about it and re-densify it and do all the things that need to be done in 2 or 3 treatments. It's just not going to happen.
Mhm.
And I think, technology gets a bad name when people are out doing that. They're
Yeah.
blaming it on the technology, and really they undersold it.
Mhm.
And then when they are doing it, have they been trained to do it right? So a lot of times a company might say, yeah, do 2 passes. Well, we do 6. So I'm not doing 2. If I can do 6 and I build the program so there's 6, you do 6 passes, and if they're saying 2 is really good, I want more than really good. I want amazing. And so again, you do a little bit more with it. And as long as you are applying the heat down in the dermis and you know where you are, and when you tack, you might be at 1.5 millimeters. Let's say you go to 2 millimeters, but you're at 45 degrees. Just think about how much more tissue you're going through. So
Yeah, but people need to be aware, like the people that are listening to this that are going to seek out this treatment, they need to be aware that more is not always better, because sometimes the procedures done too aggressively can lead to scarring and more side effects. So we're going back to go to someone who really understands the science and the physics and, what goes on behind the scenes, and understands the skin and what kind of reaction you should get from the skin and what's normal and what's not normal.
well, that's
Um, yeah.
yes.
So I wanted to ask you really quick, because you mentioned the microneedling RF, specifically the Scarlet device going up into the hairline. Why would you do that? What would that do?
If you take, for a lot of people, their scalp is so loose. Forehead, it is.
Our
You do
brain's shrinking over time. No I'm kidding.
like when I'm doing my consults and I got my hands all over. It's like,
I'm
I mean,
feeling my scalp right now. Okay.
you know, so look, if things start at some place and they go down. So if you can lift and pull
Oh,
this, you tend to get a benefit at the forehead as well. And you
beautiful.
do forehead with some scalp at the same time. Now you get brows.
Yeah.
You can elevate almost anything nowadays with the technology if you're just trained how to do it.
Right, especially for men, because it's not like they can hide things in their hairline. So that's awesome.
Yeah.
Okay, is there anyone that shouldn't do the Scarlet, the microneedling RF? Like, what are contraindications?
Well, I think there's contraindications to almost everything. Um, but when you're using radio frequency, you're always concerned about being right directly over metal or in that area. Pacemakers, internal pacemakers, defibrillators are always a concern. If you have an infection or something, or the skin issues going on in that area, you won't want to treat. So basically, all of the contraindications are pretty similar, from laser to RF to almost anything. You do want to be careful what's going on. I think light-based devices, we're a little more concerned about what other drugs you're taking and meds, especially antibiotics and things like that for light sensitivity. But generally speaking, they're pretty much the same. And the big concern is going right over metal with a lot of these devices. You'd have to be very careful of that. And that's true with the M-Sculpt and Neo and MSLA and all that. I mean, even if you have like a copper IUD, we'd be very concerned about that.
That's good to know. What about dental amalgams? Would that be a concern?
It has not been a problem.
Okay. Okay.
It has
And
not been.
then what about like darker skin tones? Can we treat skin of color with this device?
Yes, we can.
That's
That
great. That's yeah.
basically colorblind. It's just radio frequency. It doesn't. What's so interesting about the change in color? It has to do with how quickly the melanosomes heat up. It has more to do with that than actually the melanin itself or melanosomes. Since melanocytes, we have the same number. Everyone has the same.
Yeah.
So I think it's just how hot you get an area. But when it comes to this technology, it has no effect.
That's great because, a lot of my patients with skin of color have some atrophic scarring. So it's good to have this as an option
Yep.
from acne and whatnot. So I'm trying to think of all the questions I'm gonna get hit on Instagram. Um, I suspect people are gonna wonder if this device can be used to tighten labia. Have you done that?
We have other devices that we use for that, so we have not, but I can tell you that it would probably work really well.
Okay.
I think it would just numb the labia, and I think Agnes would also work really well because it literally
Okay.
contracts it. So there's it just we have other things that we've used for a long time, so we use that, and there's no numbing, and it still works beautifully. Um, so we haven't gone there with it, but we've been talked to a lot of offices that are thinking about going that direction, and I think it would be fine.
Okay. Okay. Great. And then your last one. What's your fifth hottest aesthetic device or
Well,
technology?
yeah, the technology is something that's been around for a very, very long time. Uh, this is BBL by Saiton, and this one is called Hero. And Hero is high energy, rapid output. I had to think about it for a minute.
Of course, I know.
But it's amazing because what this is allowing us to do. So Sciton is, I think, a brilliant company, and we have a
Yes.
lot of Sitons, and we love them. And I just think how they go about their business is so good in what they're engineering and how they engineer it compared to others. And we've been doing this for 25 years, and along the way, you see a lot of other companies, and it's just
They come and go. Yeah.
these guys are just there, and everything they do they almost over engineer, and but it's impressive. So Hero is photofacial in motion, and so it's
Ah,
4 times the speed, 3 times the power, twice the cooling. And so we did a lady that's 6'1", and we did every inch of her body, including her glutes and her breasts. And, it was like,
just for sun damage. So, like, yeah. So, what we're talking about. So, this is good for like browns and red spots, basically,
and all that. And I
texture
think
and tone.
it took us maybe 2.5 hours to do every inch with someone that tall.
Wow.
So, I mean, you can do so, if you typically do a few passes on someone to be successful, where you pulse, 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 and then you do another pass to get exactly what you want. And many times we'll do as many as 6 passes in the stationary mode to get what we want. Well, with in motion, it's just up, down, and then up, down. And I mean, that's kind of it. And
Nice.
it's so fast. So you can do arms and legs and backs. And so it's really body now. It's photofacial body or BBL body. And they call their photofacial BBL for broadband light.
Okay.
And you can use, the 515 wavelength, which is a shorter wavelength, going to be more superficial. You could use a 560. Seems like it's better for reds, and going a little bit deeper, you can use 590, and you can do all of it in that same motion. And boy, what a difference it makes. We did this lady's arms the other day, and we did the 4 passes. And when we got done, you could just see how the change was taking place. And she came in about a week later, and it was like, wow, look at what we did. So it's very impressive. And I
Wow.
want to point it out because I think technology, they've got what's called the M Jewel, and Sciton's got the big X platform, and they have different platforms that you can use. But the M Jewel is a new one. It's 110 instead of 220, and they have skin tightening on it. They have this in motion photofacial or BBL on it. Um, they have a diode on it that we absolutely adore, and it's kind of like a baby halo treatment. And it's just, you can go to protocol 1, protocol 2, protocol 3, go over the face. It's wonderful. And I like treatments where I get hot. I mean, I like to feel it. I feel like I did something. Something happened,
Yeah.
and you get hot with it. And, I always do it at the highest possible energy. And I'm red for a few days, like day 2, day 3, my face feels like sandpaper. And on day 4, it all just flakes off and it's so smooth and so nice. Fabulous treatment,
That's
fabulous,
great.
without
That's
really being ablative. It's just
yeah.
nice treatment. So anyway, I love their stuff, and I love that you can do full body stuff with what they've got.
So you know what I have a hard time treating? So we have lentigines or like sunspots basically, or some people call them liver spots on the hands. But then we also have seborrheic keratoses, which are like thick warty growths. There's a very mildly elevated form of a seborrheic keratosis that didn't really respond to the old IPL. Are you getting results with treating these you know how some people they have tons of seborrheic keratoses on their lower extremities and they look like lentigines, but they're really seborrheic keratoses because there's texture to them, and you don't want to liquid nitrogen them because then you leave a white scar. Is this BBL hero, this Cyton BBL hero, does it help treat that?
Well, what we would do is we would try it first because it's so fast. I mean,
Yeah,
we would know. We could do the legs in a matter of 10 minutes
it's
and not
incredible.
a great deal of time, and see if it responds. So that's the least aggressive and yet very quick, very easy to do. No one's investing a lot of time to do it, and we can see how it responds. We have found in some cases you have to resurface, and just lightly take it
Hmm.
off. And again, they have laser peel and deep resurface. They have all that. So you can just cover that area and very quickly go over it and see if that responds. But there are certain conditions where the pigment, it's not hypopigmented, but it almost looks lighter like that. And you
Yeah.
want to kill it. And I've got 3 patients that have that, and they all ride horses. And I don't know how it's related, but we have a very, very hard time. And we've tried Q switch laser, we've tried lots of different things, and we haven't been highly successful. And we're going to try some resurfacing,
Yeah,
but there
that's
are
interesting.
certain things that just it doesn't seem to respond to light.
Okay. Yeah, to hypopigmented areas. I always feel like it's easier with technologies to take something out, but it's hard to put something in.
Yeah, it's not really hypopigment. They're not. It's it's a lighter colored lesion of some sort. It looks like it should be a brown spot or a litiginy or something. It looks like that, but it's not quite that. And again, as a derm, you would be able to look at
You
that.
send me a picture. It could just be like some sort of a purpuric thing
What is
too.
it?
Yeah, we'll send pictures offline.
So
I know we always
we
go
have
off.
a few of those things, but most of the
Okay.
time with the technology, we try different things and we can get it.
Yeah. Okay. I want to do a quick summary. So as of April 2021, which we know this will change in a year, it'll be a completely different list because that's how technology is, and you're always on the cutting edge. So, as of now, as of this date, we've got the BTL Neo, and that's great for building muscle and burning fat. You know, abdomen, glutes, arms. Uh, Legs, many different places. I know you've used it in athletes even to help asymmetry and build muscle and stuff. We've got the EMSELA, EMSELLA, and it's a really cool chair you sit on, and it's a Kegel simulator, 11,000 Kegels. We've got the Agnes, which is a radio frequency device that kills fat and tightens the skin at the same time. That's usually incorporated with other procedures as well. And then we have the microneedling RF radio frequency. Um, the
That's
Scarlet is Larry's hero device. And that's good for tightening skin as well, improving laxity over time, which we all experience. And then we've got the BBL Hero from Saiton, and that is a photofacial in motion. It's high energy rapid output is what the Hero stands for, and that works really well for like browns and reds. So we're talking about texture and tone, we're talking about lifting, we're talking about tightening, and I feel like you covered it pretty well.
well, good. I think these are technologies that anyone would benefit from, any office out there. And, I think if they make a little plan, figure out what they're going to do and what they're trying to achieve with it and things like that. But the minute we talk to patients about what we have and what we can do and things like that in the consult, people get excited.
I'm
So,
excited.
uh,
Okay, Larry, I have one more question for you that I ask all my guests. How do you define radiance?
well, I look at it as luminescence more than anything. I mean, how does someone look? How do they appear? Are they radiant? Does their skin, is it really, uh, we do something here that we created 15 years ago called CT3, where we treat for color, tone, texture, and tightening. And that went worldwide through a laser company. They changed the name from CT3 to Laser 360 and took it worldwide. But what we found is when we treated for color, tone, texture, tightening, people became very radiant. And,
Mm,
and it's just, the skin appeared so nice and brilliant that um, that's kind of, I think that's what it is.
I love that. And you do quite a bit of training. So, how do people find you? How do they, if somebody wants to do a consultation with you, how do they go about doing that? Or if someone wants to train at your facility, how do they, where do they find that information?
Yeah, we are Clear Skin Institute of Laser Aesthetics, and so www.clearskininstitute. That's
Great.
probably the easiest. You can call me if you want. Um, I get quite a few of those, which created our podcast called "What Would Larry Do?"
Yeah, I was going to mention your podcast. Yeah, what would Larry do? It's the podcast. So that's a good
And
resource if you're contemplating some of these procedures as well, right?
we have quite a bit of stuff on there. So you can always call me at 602-317-0799. And we very much love to teach and do whatever we can to help you.
Thanks, Larry. Appreciate you being on.
All right, Jen, take care.
Thank you. Bye bye.